So, Lauren, did you have an uneventful trip home from Plano, Texas?
Thankfully not. It was pretty smooth sailing into BWI. What about you?
My trip to DCA was uneventful as well. We'll talk about the Nephrology Business Leadership University in a second. I did want to start with some exciting news related to Kidney X.
Yes, there's a lot happening with KidneyX and data standardization and interoperability. So why don't you give an overview of what members can expect in the coming weeks? Because I know we have a few important things planned.
Yeah, it's going to be a busy August. There are two activities this month and then one in September. Basically, when we did the announcement for the most recent Kidney X Prize, which is focused on living donation and transplantation, part of that was also an announcement from the Office of the National Coordinator for Health Information Technology, which is part of the Department of Health and Human Services. And they really want to look at opportunities, as you said, to improve data standardization and enhance interoperability across kidney care. And so this is very much HHS through the Office of the National Coordinator, ONC, focusing on kidney care, looking at these two issues of how do we standardize data and how do we increase interoperability. And it's a really important step. They're going to do two webinars and they're going to invite the entire nephrology community to participate. Those webinars are coming up this month, and it'll be an opportunity for the community to help HHS identify gaps, suggest solutions, really try to focus on more seamless data exchange, but also to really come up with ways to improve clinical decision making based on these technologies, coordinate care better, also probably develop a research agenda. So it's really exciting that A, HHS wants to work with the nephrology community, and B, that they are scheduling these two webinars. And I can talk a little bit about sort of the specifics in a second, but just to have this opportunity, I think is unique. And it's one that I hope we as a community really take advantage of.
Yeah, I agree. I think this is an incredibly exciting opportunity. ASN has been pretty involved in data policy recently with the announcements to BRDC. So I think this will be another opportunity to continue to engage with the federal government as well as pull together the entire community to just really get these issues on paper and start working towards a solution. Did you want to go into more detail on when these two webinars are and what the main focus of both of them will be?
Sure. So the first one's on Monday, August 24th. It is from 12 to 2 Eastern Daylight Time. So again, Monday, August 24th, from 12 to 2 Eastern Daylight Time. And that one's really going to focus on sort of chronic kidney disease and dialysis. And so that'll be the focus. There'll be other issues discussed, but really there'll be an opportunity for HHS to hear from some experts from the community and then throw it open for a broader discussion around kind of data standards, interoperability within kidney diseases, chronic kidney disease, and dialysis. The second webinar will be on Monday, August 31st. So these are consecutive Mondays from 1:30 p.m. to 3:30 p.m., again, Eastern Daylight Time. And that one will really focus on transplantation. And that sort of links back, I think, a little bit to the Kidney X Prize on living donation. So again, just to provide the details, that'll be Monday, August 31st from 1:30 to 3:30 Eastern Daylight Time, really focused on the transplant issues related to interoperability and data standards. So it's a huge opportunity for the community. We will be communicating through every channel possible so that we get as broad a representation. And really, this is a unique opportunity for the kidney community and for ASN members to help shape federal policy and help address these issues. I know it's difficult sort of in the middle of the day, but hopefully we can have a good turnout and really be as responsive to the questions from the federal government as possible.
Yes, and like you mentioned, we will be sending out the links on all ASN's marketing channels, but in particular, keep an eye out for this upcoming Policy Insider newsletter, which is set to be released on August 17th. Where we will include a written version of what we just discussed on the information as well as a registration link. So definitely stay tuned for that.
Yeah, it's really kind of an exciting transition to how you led the presentation at NBLU around why it's important for nephrology fellows and for nephrologists to engage with federal health policy. And you started with Taylor's version. So why did you think that was so important to kind of start your presentation with that analogy?
I think starting with Taylor's version was important because not only am I a Swiftie, so it was a personal desire of mine to, get up and talk to the fellows about Taylor Swift, But I think the story of Taylor Swift and her re-releasing her music following the realization that she no longer owned the rights or what was going to happen with her music is a really good demonstration to fellows as to why it's important for them to engage with federal policy and at least be up to date, if not actually participating in the federal policy arena. And that's because we really want to encourage both physicians and fellows to have a say at the table, to be at the table and have the opportunity to influence policy before it is set in stone and not have those who may not be familiar with their day-to-day practice making those decisions for them.
Yeah, and can you just for those members of our audience who are not Swifties, can you give us the sort of 1 minute overview as to what Taylor's version means?
Of course. So, if you're not familiar, Taylor Swift has been in the process over the past 2 or 3 years of re-recording some of her most iconic albums. And this is because she came to the realization that when she first signed for her first record label deal, she was actually not the main owner of the rights to her music, and her record label was, which they did not really give her any flexibility to do what she wanted to do with that music. So, in an attempt to take back her power and have say over her music and her artistic content, she has been in the process of re recording a majority of her albums. I think she has two more to go, but that really gives her the ability to be in control of her music and what it's used to do.
Yeah, so for baby boomers, the example or the comparison would be when Michael Jackson ended up owning the Beatles catalog. So they did not control their own
Oh,
music.
I didn't know that.
Yeah, it was amazing that sound, and it ended up with Michael Jackson, who then sold a lot of the songs to be used for advertising. So it's an interesting comparison. So, during the presentation with NBLU and with the second year fellows, there are about a 75 of them there. You spent a lot of time talking about the sort of how kidney health policy fits within the federal government, the executive order for advancing American kidney health, which celebrated its sixth anniversary last month. Talked a lot about the hearing this year at Ways and Means and why that testimony was so important and the possibility of a HHS officer of kidney health and transplantation. Focused a little bit on selected priorities for this year from a policy and advocacy perspective, and then finally really gave them, I think, concrete ideas for how they can be both effective advocates but get more involved in organizations like ASN. Why did you organize your presentation around those sort of five tenets?
The main message that we wanted to send is that kidney health policy is incredibly important, and there's a lot of federal involvement in kidney health policy, particularly because even though ESRD patients represent less than 1% of the Medicare spending budget, or less than 1% of the Medicare patient population, they account for around 6 to 7% of all Medicare spending. And I think you had a brilliant slide that really demonstrated the financial impact of ESRD patients.
One of the really important things is for the fellows who have a lot of exposure to dialysis and to the Medicare ESRD program, but have much less sort of, especially from a policy perspective, much less of a sense of what are the different levers to encourage nephrologists to um, screen, treat patients early, slow the progression of kidney diseases, the sort of S and stand for kidney health. We talked a lot about transplant policy, and I do think, there was a lot of interest in the transplant issues with them. I was really struck by how many of them were interested in innovation and research. And even though this meeting is really intended for fellows that are interested in a career as a community-based nephrologist, we got a lot of questions around, particularly clinical research, which I thought was interesting, and sort of what the potential role could be in their practice. And then a large number of the fellows are international medical graduates, so there's a lot of interest in issues around changes to IMG policy, to immigration policy, to visas. And so I do think that's a big piece in terms of the workload moving forward. And then finally, again, we got a lot of questions around the care models, around IOTA, and also just thinking about ways to, the CMMI is really looking at the SRD program and looking at their spend differently. So what sort of stood out to you as I kind of quickly go through Stanford Kidney Health in terms of the questions you got from the fellows?
Honestly, I was really struck by this cohort's, general deep knowledge of kidney health policy. In the past, there didn't seem to be as much familiarity, but like you said, the fellows were incredibly engaged, particularly on innovation, transplant, as well as the CMMI models, which it's fun to know that people are aware of these models, because usually when they engage with the community, there can be a little bit of a knowledge gap. So to know the next generation is very interested and wants to be involved in it is really exciting. And to really tie it all together, the other main question I noticed from the fellows is how to get involved. I think in today's political environment, there's a lot going on, and it can be hard to keep track of what's important and what's not important. And, it was really exciting to have conversations with them on how they can be involved and empowering them to have the confidence to reach out to their members of Congress, whether it be through the means that ASN offers, such as the Legislative Action Center, or just keeping up to date with our kidney health advocacy timeline, or doing it independently. So I left that meeting feeling really inspired on the next generations of nephrologists and their overall already deep understanding of kidney policy, as well as their enthusiasm and excitement to get engaged in the future.
Yeah, and even though it didn't come up as much at our session, what I was struck by was there were a number of questions around the effect of private equity on private practice and on sort of careers in nephrology and in medicine. And I think that's clearly that the current group of trainees, fellows, residents, students are very much aware of what's happening from sort of external forces and how that and just sort of the money right now and how that's affecting the future of medicine.
Yeah, I agree. It's going to be interesting as time goes on, and, exploring ways to be more engaged on that on the policy front will be interesting as well.
So before we go, I have to ask you, I know you were in the middle of drafting ASN's responses to the various proposed rules and requests for information. Uh, what's your best guess on how long ASN's different responses are going to be?
So I think the biggest one this year is going to be the ES3 PPS QUIP. And because our letter is turning out to be so long, we've decided that we're going to ultimately send two letters. So the first one's going to address the general rule changes, so like your ES3 PPS base rate changes, etc. And then because of the breadth of the RFIs, which included over 140 questions, we're going to be submitting a separate letter with the RFIs, and that's looking out to be around 120 pages at the moment. We're working really hard to kind of cut down on that, but we are really excited for this opportunity to have the ability to share our policy priorities in these areas. And the RFIs touch on a variety of topics, including home dialysis, palliative care, which is really exciting because we haven't really had the opportunity to engage with CMS on that, and a few other topics. So stay tuned. I think the second longest one's going to be the physician fee schedule. That'll probably be around 20 pages. But yeah, it's been a busy summer rulemaking season, but we're halfway there. So stay tuned on where we land with that.
Yeah, it's interesting because the opportunity to respond with the RFI is one that you just don't want to miss. And I think it's really important, even though it's a lot of work, to, when they ask these questions to respond because they're clear this is what they're thinking about. And it's a little irresponsible not to respond because I think then when CMS goes forward with different proposals in the future, if you haven't had a chance to comment and be on the record, then I think you're sort of in a tougher spot in terms of negotiating or at least responding and being critical, if you will. And this is a really, really interesting time. And so to respond, I just appreciate how much time you and the Quality Committee and other ASN volunteers are spending on this.
Yeah, I mean, a huge shout out to the ASN Quality Committee, which has spent hours formulating these responses. And I'm proud to say that when we first presented the RFIs, there's a little bit of, anxiety, nervousness on whether or not we're going to be able to answer every single one of those questions. And I'm proud to say that ASN has responded to each individual question. We're actually going to be joining the kidney community and asking CMS to extend the opportunity to comment because, there are a few that we really want to dive deeper in, and we're kind of constrained by that 60-day comment period. So the ability to have more time to provide additional feedback would be really welcome. And we're hopeful that the CMS will grant that, but we'll have to see.
Well, great. Thank you. And again, thank you for spending so much time on this. And just to circle back to the two webinars with the Officer of the National Coordinator at HHS, Monday, August 24th from 12 to 2 p.m. Eastern Daylight Time. Monday, August 31st from 1:30 to 3:30 p.m. Eastern Daylight Time. There's also going to be a opportunity in September. The next time we record, we'll add that one, but we're trying to sort of parse out this information so people don't feel overwhelmed. So, Lauren, thank you, and I look forward to reading the responses to the proposed rules.
Oh, thank you very much. It will be long.
Thank you for listening to this podcast by the American Society of Nephrology. I'm Todd Ibrahim, Chief Executive Officer and Executive Vice President of ASN. This podcast should not be used in any medical emergency or for the diagnosis or treatment of any medical condition. If you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment, please consult your doctor or another qualified healthcare professional. Views expressed on this podcast are those of the speakers and not necessarily those of the American Society of Nephrology. This podcast should not be used in any medical emergency or for the diagnosis or treatment of any medical condition. If you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment, please consult your doctor or another qualified healthcare professional.